This episode of the Dental Insiders podcast has been brought to you by IsoLite Systems, makers of IsoLite, IsoDry, and IsoVac, where better isolation equals better dentistry. Learn more at isolitesystems.com. Of our interview with David Rice from IgniteDDS. David, thanks for joining us again. We're going to jump right into it because I have a feeling we're going to have a lot to talk about, and we don't want to go to part 3 because that violates all of our
covenants.
Our covenants, which are very, very written in pencil.
That lawyer was expensive.
Yes. So let's just sort of pick up where we left off on dental students, because I think you have such a fascinating perspective on their view of things. You're like this communicator of kind of what they see. What do dental students think about all those traditional things that we do and take for granted? Things like trade shows, printed magazines, dealers, all the things that we just assume and accept,
take as
given,
as the way we do business in this industry.
Right. What do they think of that?
Yeah, I guess I'm going to play off your covenant, and if instead of pencil it was like chiseled in stone, that might not be a bad way to describe how they look at some of the things we've done for the last 50 years, just because that's the way we do it.
Right.
And I think trade shows are in trouble. I think we've got to, if they still want live events. There's no question that this next generation still embraces the relationship aspect of everything, but they have to be targeted. They have to be content rich. It has to be worth their time. And, you know, time is money. They're young. They've got that debt we talked about earlier. So the focus needs to change. Obviously, digital is, you know, very fastly taking over print. And so the world as we know it, I think, is going to get turned upside down in the next few years.
I guess then we're going to scrap that idea to do the Dental Insiders monthly magazine.
Yeah, I think we are. Yeah,
okay.
I think we'll
posters. Do posters.
Yeah, right.
I think
We'll do digital posters.
I thought the weekly fax. I thought that was the right idea, right? That we would send a fax every week, but then I couldn't find a fax machine.
Called the Bridge to Nowhere.
The Bridge to Nowhere. You know,
put a message in a bottle. I don't know.
Yeah, exactly. So a little bit more along this insight into the psyche of the dental student or the fresh young dentist. You talked about earlier in part 1. You talked about if they were into it, if it was something they believed in, a passion, that there was no time clock, there were no hours in the day, so to speak. You know, and of course there's competing priorities. So when we talk about, you know, the need for specifically trade shows, because we like to pick on trade shows to change, and that there is a place for these live events. How do they prioritize what gets their attention, what gets their time? And I guess what I'm really asking is, how do events and how do these shows need to change so that they will be prioritized in what gets their share of time?
That's a really good question. And I guess I would look, again, if you look at them generationally and you think about from an experience standpoint, what they learned from mom and dad and why the millennials are Generation Y is they question everything. So the whole dental model of these trade shows is very corporately driven. And corporate America is absolutely not what the millennial is after. They don't trust them. And maybe sometimes rightly so. So if I'm trying to build a program where I want to attract somebody, then I have to take that corporate model out and get people on board with the personal relationship. So, you know, they buy Michael Dunn. That's who they buy. And when they buy Michael Dunn, then they buy everything Michael Dunn does. So if I'm a dental corporation, then I get boots on the ground. I get my very best communicators and my best people who have something really to offer and build a relationship. And then from that relationship, you can build a program. It just needs to be a little bit tighter time frame and more manageable for their lives.
Would you say that, and I'm putting words in your mouth here, but what I'm hearing is that, you know, instead of these vast quasi-empty exhibit halls, we really need more intimate settings where we're passing knowledge and exchanging experiences.
Absolutely. Yep. Intimate, targeted, more one-on-one time, smaller groups. That's the way to go for sure.
Yeah. And something we've always talked about is how we think that
the personal development side is kind of been not forgotten about. It's like it hasn't been discovered yet. It's like just like the business. You know, I mean, this isn't a one-legged stool. It's not a three-legged stool. It's probably got 8 legs. You know what I mean? I don't know how many.
It's a spider stool.
It's a squid stool, I think. And it's I just like squids better than octopus. So there's the business is one of the things you've identified as missing, and it's so good that it's being addressed and it's helping them. But there are other things that are missing too, right? I mean, there's from mentorship, from personal development, from making a connection. We all want to be, and I'm a believer in this. We all want to be part of a group, a clan, an environment where we share likely things. And similar things in like, so we feel like we belong and feel like we're important. And I do feel like that's been missing for so long. And I think you've tapped right into it where these people are like, man, I feel like I'm connected. I could be on the East Coast, but now I'm kind of connected through this guy in the industry, this company, this movement that is somebody on the West Coast that we can share from. So it's such a powerful thing. What were you, this is what I was going to ask you is if you weren't involved in dentistry, what would you be doing? What's your hidden talent?
I have no talents whatsoever. Oh, gosh. You know what? I probably would have given the professional baseball thing a go.
Wow, really?
I know. I got pretty far, and then my father talked some sense into me and kind of showed me a few people a couple years ahead who were either riding the bench in the minor leagues or, got hurt, had some surgery, and were all finished. But I would have, retrospect, every kid's dream is to, play for a living. So that would have been okay.
Yeah.
Were you a pitcher, infield, outfield?
Yeah, pitched. Yep.
Wow.
Those were good days.
So I'm going to switch gears here for a minute.
There goes that catchphrase.
As I often do. There's a T-shirt somewhere waiting to happen, waiting to be hatched. So I wrote, when we were talking earlier about the psyche of the dental students, I wrote down a couple of things that you said. You used a phrase like they embrace relationships, and you used another phrase, personal relationships. I want to talk about one of your personal relationships. You are engaged with Miss Anastasia Turchetta, which a lot of people know from her various social media and YouTube videos and what have you. And I know that she plays a role with Ignite. And so, you've got a good working relationship with her. And so in Ignite, and I'm just curious, in a dental practice, what's your take on spouses working together in the practice?
My rule of thumb is do whatever Anastasia tells me and I'm okay.
Great answer.
Yep. That's going to work for me later. I think working with somebody together in a dental practice is difficult. Our working relationship is very, very structured intentionally. So I wouldn't recommend working with a mom or a dad or a spouse unless you really sit back and iron out an entire professional relationship that's separate from your personal one. Make sure that philosophically you're on the same page. Make sure from a business standpoint you're looking at the world the same way. And if you are, okay, have a great business structure so you've got documentation to go back to and look at, so it's not a personal choice as to whether we say yes or whether we say no. It's we've agreed on this. But you really have to separate church and state, essentially. And,
right.
Do it on day one when everybody's happy.
Yeah, and that's kind of comes down to communication, how important that is. Because we happen to be in an industry where spouses working together is pretty common.
Yeah.
And I don't know what the percentage is, but it's more than 5% and less than 50, but it's somewhere in between there. Maybe 10 to 20% of practices are a spouse and a.
No one's surprised to hear what a dentist say that a spouse is working the practice.
Yeah, it's not. You don't go, oh, really? Boy, that's peculiar. So it's definitely something that's there, and I feel like maybe there's just everybody's got their own way of doing it. But communication seems like in any business, in any relationship, it's important to keep that communication open and get it out there. How do you? So let's talk about communication and your audience, your community. How do you communicate with them? Like, how do you? This is specifically the IgniteDDS crowd. How do you communicate with them?
In a lot of different ways. So I try to make sure that I'm available to them where they like to play. So obviously we have a huge social presence, Facebook, Instagram, etc. And that's where a lot of students and young dentists will message me. On our website itself, we have a whole private messaging system, so we communicate there. Email and text. You know, we do a lot of texting back and forth. So it's work, but I value their time. I value them as people. So for me, they're just 13,000 of my friends, and whatever makes sense in their day is, you know, it's the greatest invention in the whole world, right? So whether it's text, email, or a message from some social media forum, it's just as easy for me to get.
Right. And every piece of communication, I guess from where you are, every piece of communication is really, it's research in a way, right? So when someone asks you a question or gives you some information over here, you think, oh, wow, this could apply, you know, kind of globally to my whole community. And so you're always on. So you're pretty much always on.
I'm always, yeah, you know, it's funny you say that. So Anastasia and I have we got 8:30 at night is the timeout session, and to create that balance. But you're right. Otherwise, you know, 16 hours a day, I'm open to conversation, and sometimes it's one-on-one, and sometimes it's a group, and sometimes it starts as one-on-one, and we push it to a group because there's so many students with the same question.
So a lot of that answer was really about the power of technology to drive, improve, enhance communication. And in part one, you talked about your practice being very technology focused. So I want to go kind of back to that. And in your practice, what technologies do you use, and what technologies do you think I couldn't practice without this now?
Yeah, I would think, you know, like most dental practices today, obviously from a radiographic standpoint, we're fully digital. That's a must that I can't imagine doing anything different. We're a big CAD/CAM practice. I'm a huge fan of CEREC. There's no way I'm practicing dentistry without that. XG3D is one of Sirona's 3D pieces of technology that allows us to integrate. Love where dentistry is headed in that direction. I mean, convenience for a patient, efficiency with our procedures and our process is unbelievable. But I would say, you know, digital radiography, CEREC, and CBCT are my winning three, and throw in a soft tissue laser, and I'm probably good 90% of days.
Cool.
Well, and I would imagine having that prosthodontist as part of the practice, and being then able to utilize, you know, tissue scans in combination with radiographs to do that prosthetically driven treatment planning on an implant, for instance. It's probably I would just guess a big part of your practice.
Yeah, that whole platform is just. There is no ceiling to it, and you know, I'm pumped to know where we're going to head. You know, eventually we'll be diagnostically working up patients on all that technology from day one instead of maybe day 2 or 3. It's phenomenal, and it's fun to see a 70-year-old prosthodontist embrace the technology, and he owns it. He's so good with it, and the learning curve is so shallow these days.
Yeah,
it's easy.
So what you're saying is you can teach an old dog new tricks.
As long as you have treats.
Yeah. So what's the oldest member of IgniteDDS? Do you call them members? What do you call the people who follow you?
You know, that's we're still working on what we call those guys. You know, we thought about fire starters, but then the police come knocking on my door and bad things happen. So no. The oldest member is 4.5 years. So we beta tested, you know, 6 months prior to everything, and we had a small group at that point, and I still talk to that small group probably every month at least.
Really?
Would they be called sparks if they're fire starters?
Sparkers.
Yeah.
Sparkers.
I mean,
Sparklers.
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 Now we might be onto something.
Yeah, I was going to say embers, but that's more the other end of the spectrum.
Yeah. Maybe Dental Insiders is really just this incubator for.
This is the think tank.
Yeah,
it is. It's a think tank.
So actually, you answered the question differently than what my intention was. What I really meant was, what's the age group? So you've got 18. I'm sorry, you probably don't have 18-year-olds, but you have 22-year-olds, probably on the low end, right? People who are just getting into dental school.
Yep.
What's on the what's the stretch? Do you have any 40-year-olds, or is it pretty much people in their 20s and 30s? What's the demographic?
No, we actually stretch into the mid-40s. So you know the dental school admissions is all over the board. You've got people second career in, We also have a lot of residency programs that we spoke to a few years ago. So, a surgical residency could be 7 years long. So, now we're talking about somebody who's rolling out of their formal education already mid to late 30s. So, yep, we're mid 40s, early 20s to mid 40s.
Sparklers are definitely on a mission. And you talked earlier about a majority of your sparklers being, of these 13,000, really being mission driven. And so, I think to wrap up part two on a high note here, I'll ask the very broad question, because I think you're into this. This is what Ignite is about. But what can we all do to make this profession better?
We've got to start checking our egos at the door. We have to stop having this whole personal agenda thing going on. I mean, there's a lot of major corporations that are merging, partnerships behind the scenes. And if we really want dentistry to flourish, we're going to have to come together and just start remembering that this whole thing began with a patient. And from that patient stemmed a dentist and a practice and a team full of people. And we've got to get back to our core values and our roots, and the money will come. We just do the right thing and the money will come. That's been my experience and the experience of so many people that I know.
Yeah, and that's kind of the tricky thing, is that, so from a practitioner's point of view, I agree that the focus has got to be on the patient, right? Otherwise, it'll never work. It's never long term. It'll be a bad deal from the start. But from the industry side, so Michael and I kind of travel in the industry, so we see it from all different sides. On the industry side, to them, and I'm saying them, manufacturers is really who I'm talking about. It's really not a patient-driven industry, although I'm sure that they would disagree and start a discussion and really an argument that I had it wrong. But to them, it's a product. It's about moving a product. It's a product industry. It's about new technology, and it's really what it's about, because that eventually makes the practitioner's life easier and the patient's life better, right? It's sort of this, they see it totally in reverse. I think upside down, I guess is what I'd say, is they see it as the product makes your life easier, makes the patient's life better. Whereas I feel like the right way to look at it, and maybe it's just through the eyes of the clinician, is we've got to make it better for the patient, and then that will improve. From that, all else follows. Yeah, what do you think about that?
I would totally agree. And if you boil it down to one word, call it relationship, because especially in the distributors world that we see right now in dentistry. So there's, two major players, and then there's a conglomerate that maybe make up the other third. And, those guys and gals don't always necessarily get along. And then one day you wake up and, here comes Amazon. And, so it really is about the relationship. And otherwise you wake up one day and somebody else has figured out a better way to do what you've been doing for 50 years. So the technology is amazing and important, and the product is amazing and important, but if you remember the relationship, you're going to win.
Right. Agreed.
Well, I think that wraps it up. That wraps up yet another insightful, dare I say, brilliant episode of the Dental Insiders. So we'd like to thank our guest, Dr. David Rice, for joining us. Thank you, David. We appreciate it.
Yeah.
And thank you, our smart, beautiful audience, for spending some time with us. Please join us next time and tell your friends and colleagues about the Dental Insiders.
Thanks, David.
Thanks, David.
Hey, you're welcome, guys.
This episode of the Dental Insiders podcast has been brought to you by IsoLite Systems, makers of IsoLite, IsoDry, and IsoVac. Learn more at isolitesystems.com.